Hi, I'm Shashank Bhargav, and you're listening to Three Things, the Indian Express news show. The COVID-19 infections in most states in India have come down after the devastating second wave. But that has not been the case with Kerala. Kerala has been an outlier because after the dip in May and June, the cases there have continued to rise. In fact, for the past 1 week, it has been reporting nearly 30,000 new cases every day, which amounts to roughly 75% of India's total daily cases. This latest surge comes after the Onam celebrations that ended last week. But what is the reason that Kerala has been seeing a steady rise in cases? And what has this meant for the people in the state who have been dealing with strict lockdowns and hefty fines being imposed by the state police? In this episode, we speak to Vishnu Varma, who writes on Kerala for the Indian Express, and who recently reported on a 5-part series trying to answer this question. And he says that to understand this, we need to understand how Kerala has fought the pandemic compared to the other states in the country.
So the state has traversed a very different path compared to other states. And the model that the government has followed last year and this year has always been on testing a large section of people, put efforts into containment and tracing, and provide facilities at the grassroots level so that hospitals at the apex level don't get overwhelmed. That has always been the model that the state has followed. The government has always sort of tried to ensure that hospitals are not overwhelmed, that oxygen supply does not run out. As we saw during the second wave of the pandemic in cities like Delhi and other states like UP, Rajasthan, how people were dying outside hospitals for want of oxygen or for want of medical treatment, which has not happened in Kerala. So delaying the peak of the pandemic is how health experts used to call it in Kerala, where we continually pushed the peak of the pandemic as far as possible so that hospitals don't get overwhelmed or medical facilities don't get overwhelmed.
This is the reason he says the cases in Kerala have not gone down significantly like we have seen in other states. For example, a state like UP, with a population of 20 crore, had reported just 14 new cases the day before, while Kerala, which has a population of around 3.5 crore, on the same day reported nearly 30,000 cases. This, he says, also has to do with higher testing and the way testing is being conducted.
The testing paradigm being followed is also much different from other states in the sense that if a person tests positive, his contacts are being tested. It's not like they are being subjected to quarantine and let off. The primary, secondary contacts are being found out. They are being tested. The entire family of that person is being subjected to testing. And what we can find is when one person tests positive, his or her entire family is also testing positive, mainly because of the Delta variant of the virus, right? It's a highly transmissible variant of the virus. It spreads very quickly through air. And so when one person gets COVID, it very easily latches on to other people in his family quite quickly, even before he tests positive. So that's why I think the health minister said about 35% of the cases being reported every day are within households itself. So if it's a 6-member or 8-member household, all of them are testing positive is what we see.
So higher testing and the Delta variant are two factors, while another factor to consider are the results of the latest Sero survey, which reveals that unlike other states, nearly 55% of the population in Kerala is still susceptible to the virus. Vishnu says that this also highlights just how effective Kerala's previous containment strategy was and how well the state's Break the Chain campaign worked.
So the Sero survey findings clearly show that Kerala is likely to see more surge in cases. Currently the state is testing around 1.5 lakh samples a day, but if we were to increase it to say 2 lakh samples a day, we would easily get over 40,000 cases a day. So these are a couple of reasons why I think Kerala continues to see a spurt. It is also a very highly densely populated state as compared to states like UP or MP where there are large farmlands, etc. This was one of the findings of the 6-member central team, that Kerala is a highly densely populated state. It's a rural state in the sense that there is no clear demarcation between rural and urban areas. It is also a state with large number of people suffering from lifestyle diseases like diabetes. So all of these comorbidities are quite high in a significant section of the population here, which obviously increases their chances of getting the virus also. So I think a whole host of these reasons are what's causing the virus to continue surge in Kerala.
Though this surge has meant that the state government has continued to implement strict COVID-19 protocols. And this has been going on since last year. When other states were relaxing their norms, Kerala, because of this rise in cases, had to continue imposing restrictions. And Vishnu says that because of this, people have now become completely fatigued.
It completely hampers their movement within and outside the state. There are a lot of restrictions on opening of shops, their enterprises, offices, traveling at night. So all of these restrictions really made people quite unpleasant, created a deep-seated anger among the public, especially traders, on how it hampers economic activity. Because as important as lives are, livelihoods are also important. These are also people, entire families depend on one person's job or one person's business. So how and well that business performs, that family's survival depends on that. So obviously the restrictions imposed by the government are sort of seen as preventing people from going about their daily life as they used to. If last year they sort of learned to live with the virus, this year they want easy solutions from the government. They want the government to be more proactive in terms of protecting their livelihoods as well.
Earlier this month, Vishnu had visited a village called Chemancheri to report on this story. And there, the vice president of the panchayat told him that now when health officials tell people to follow restrictions, they get really angry.
Because these are people, there were a lot of daily wagers there. So if they don't go to work that day, their family will find it hard to survive. So these are the kind of problems. So if they come in contact with someone who turned out to be positive, then they have to remain in quarantine for 7 days or 2 weeks, which completely destroys all their wages, their livelihood. So naturally people are angry, they are reacting, they do not follow what health officials are saying. I think at the grassroots level also there have been a lot of complaints of health officials being told by the public that it is just not easy to follow these protocols, especially when our livelihoods are at stake. So yeah, that's the picture I got.
Now, following COVID restrictions that will help curb the spread of the virus is one thing. But the state in some areas had also implemented policies that many experts thought were flawed, and ones that really frustrated people. This happened after the peak of the second wave, when a complete lockdown was not possible and when people were demanding a system that would allow for some economic activities to resume.
So that's when the state came up, this was sometime in early or mid-June, when the state came up with the model which was based on test positivity rate of a local body. So there are rural and urban local bodies like panchayats, municipalities, corporations, etc., which will test a certain number of samples every day and in a week. And based on the weekly TPR, based on the weekly test positivity rate, the district administration has the choice of imposing restrictions there. So if the TPR is below 5, then it will be a green zone, which means there won't be any restrictions. If it's between 5 and 10, there would be some kind of restrictions. Between 10 and 15, there would be much more stronger restrictions in terms of opening of shops from a certain duration for a certain days in the week. And if it's more than 15, it would be a complete lockdown or a triple lockdown, as they say, where everything is shut for a week. So what happens is, even within a district, because these are rural and urban local bodies spread across the district, there could be a local body which is a green zone with no restrictions, and there could be a local body just beside it which is under triple lockdown. And so people with the TPR based model, the idea was to allow local bodies in the district administrations to fix their own rules so that the orders don't come from Trivandrum, where state health officials are sitting.
The idea was that people at the grassroots level should make their own restrictions. But this system did not work, because places which were more densely populated would often end up in the red zones where heavy restrictions would be imposed. A perfect example of this was the SM Street in Kozhikode, which is a popular shopping street. This street, based on the new system, would constantly come under the red or orange zone, under which only the essential shops would be allowed to open.
So this results in like shops selling clothes, jewelry, footwear, all of these shops being closed for almost 6 days a week. So they're only allowed to open once a week. This went on for several weeks in July and August. Even in the first week of August when I went to SM Street, they were allowed to open only once a week, which is really, really difficult and tough for the traders there, for the businesses there, because they still have to pay the rent, they still have to pay their EMIs and their loans, but they're only allowed to trade once a day, which is nothing, doesn't bring in any kind of revenue. So a lot of traders, businesses were quite unhappy, unsatisfied with this kind of model, and they came up in the form of a protest. They came up to the street openly, they had placards and they shouted slogans against the government, and they came almost close to an open confrontation with the government. They said that we don't care what the government says because our livelihoods are at stake. So these kind of expressions of anger were quite evident, not just on SM Street in Kozhikode, but across urban locations in Trivandrum, Kochi, etc., and other cities also. They were quite visible, and it showed that especially the trader community, the small and medium scale business community, were quite angry with the way protocols were being defined without taking them into confidence.
After the protest took place, the system was changed. The test positivity rate system was replaced with a new system that was much more fair and nuanced. This system took into account the population of the region. But with this new system also came a new rule, which said that those going to the shops must produce a vaccination certificate or an RT-PCR negative result not older than 72 hours. And this would even apply to someone who was just going to buy something like rice from a shop.
So this was completely bewildering to everyone, the traders, businesses. I mean, to buy 1 kilogram of rice for ₹60, to go for a test doing $500 just to do that is completely ridiculous. And it created a lot of, again, anger against the government. Some health official in Trivandrum is making these rules without actually thinking how it would actually practically work on the ground. On that count, I think what the Kerala government was thinking was, because just in July, it had got a rap from the Supreme Court for allowing relaxations during Bakrid. The Supreme Court had sternly said that Kerala was contributing the most number of cases and it was allowing relaxations during festivals, and the Supreme Court had sharply criticized the government for doing that. It had said that the government cannot allow relaxations during festivals, especially when it knows that cases will surge. And so the government had to show that it was not in favor of relaxations, which is why I think they came up with the order, this bizarre order of having an RT-PCR certificate or a vaccination certificate to go to the shops. And obviously the government and the health minister, everybody knows that people are not going to comply with these protocols, and nobody is actually complying with these protocols. No shopkeeper is going to ask a customer whether he's doubly vaccinated or has a RT-PCR negative certificate just because he wants to buy something. So yeah, on the part of the government, it was to please the Supreme Court that it was very serious about containing the pandemic. But at the same time, why have a bizarre rule in the first place also? It's something that rankles public and the media and even politicians from opposition parties as well.
Now, apart from the strict and sometimes bizarre protocols, the other thing that people in the state are frustrated by is the local police imposing hefty fines on people who break COVID protocols. Vishnu says that for the past 3 months, the public has been particularly angry about this. People claim that the police has been ruthless at those from the lower and middle stratas of society while being lenient towards the super rich and privileged. One example of this took place in a small town of Vaithri in the Wayanad district, where people were fined for removing their masks while sipping tea. The incident had taken place at a small tea stall.
So the government protocols do not allow people to lower their masks when they are in public at any point of time. Even if they are in a shop or on the road, you cannot put your mask down. And there are people who have been fined 500 rupees, $1,000 just for putting their mask down their nose or their mouth. This is quite routine. So these were people who are drinking tea by the shop in disposable glasses. And there are people who are these sector magistrates by the district administration to check whether protocols are being followed. So they move around in a car through the streets and they see if people are following protocols, if people are crowding at a certain point, if they are not wearing masks, etc. And their job is to basically impose fines and hand over their contact details to the local police station so that the police can impose fines. So when the sector magistrate came near this shop and they found that people were drinking tea from this tea shop, he proceeded to fine the people who were drinking tea as well as the shop owner. So the shop owner had already been fined twice in the past for basically giving tea, and for very menial offenses they had been fined before. So they were at a crisis. They had shut their shop for long periods during the lockdown, and there were two entire families who were depending on the income generated from that shop. So when the sector magistrate informed them that the police would put a fine on them, they sort of reacted,
He says that the people quickly surrounded the car of the sector magistrate and they demanded that the fine should be cancelled. They said that the fine was draconian and it affected small businesses at a particularly difficult time.
So after a few minutes, they allow the sector magistrate to go when he says that the fine will be withdrawn. But obviously the next day, the police file a case against the shop owner for standing in the way of government officer doing his duty. So this is what happened. So this is one of the many cases of alleged police excesses on people, especially from low and middle income backgrounds during a crisis like this. So for very small offenses, the fines are as big as 2,000 rupees and 3,000 rupees. There's one shopkeeper in Wayanad who told me that he had closed his shop 10 minutes late during a curfew. The curfew starts at 7 and he had closed his shop at 7:10 p.m. And there were no customers in the shop at that time. He and his son were just closing down their shop, and the police immediately came and handed out a 3,000 rupees fine. And they had to pay it, because if you did not pay, then case would be filed against you for violating COVID protocols. A lot of these cases began to be reported across the state, and there were media reports that the police collected as high as rupees 125 crore just in fines in the last 3 months, which is a huge, huge amount of money. And how the police were discriminating against people from low and middle income backgrounds, where they chose to be lenient on those from high income communities. The police were particularly harsh on those from low and middle income sections.
Vishnu says that the public anger against such fines also resulted in a huge uproar in the Kerala Assembly. The UDF, which is the opposition party in the state, hit out at the government saying that it is bringing in the police Raj in Kerala.
But the government stoutly defended the police. They said that the police were there to ensure that COVID protocols are being followed and that they are not doing anything wrong. So this is one of the episodes which had generated a huge amount of discussion in the state at this time.
Meanwhile, the economic distress due to COVID has been paralyzing for many in the state. And this is because there are much fewer jobs available now.
So there are very fewer jobs. The economy is completely battered. There are already an influx of the migrant workers from other states who are in Kerala. They are also in the hunt for jobs. A lot of people from the Gulf have come back after they lost jobs there. We know that Kerala contributes a large section of people to work in Gulf countries, in the blue collar and white collar workforce. Many of them, thousands of lost jobs, they have come back. There are also a lot of people who have jobs in the Gulf but are unable to go back because they are not doubly vaccinated. So countries like the UAE and other countries in the GCC, they have rules for people to be vaccinated or to have RT-PCR negative result before they fly there. And there are strict quarantine restrictions also. These are some of the many problems that people in the state faced during the last 3 months.
This has been particularly distressing for the daily wage workers and those from the marginalized communities. When Vishnu travelled to Wayanad, he could see this at the tea and coffee estates.
A large number of SC/ST families have people working on these estates, working on cutting trees, etc. They have lost jobs. So when you lose jobs, you're forced to live at home for a longer period. And these are families who are forced to now depend on the rations and the government food kits That's the only way they're surviving, as I've written in that story, that many of these families have lost their savings. They're completely slashed of their savings. And when they have health emergencies, etc., it becomes really tough for them to sort of move on.
During this time, there has also been a rise in the prices of materials like cement and steel, which has affected construction workers. And there has also been a low demand and prices for agricultural products, which has really affected the farming sector.
We just also went through a very tough monsoon season, and the quantity of rains received during the season is quite incremental to the farming produce of the state. So if you don't have enough sufficient rains, it affects the sector quite badly. Purchasing power is vastly reduced. A lot of people, salaried individuals, also have seen their salaries being reduced or completely cut out. So it has completely hit all sections of the people in a way, except probably government employees who receive their salaries on time. Almost all other sectors have been badly affected.
Correlated to the crippling economic crisis has also been a reported rise in suicides in Kerala. According to local media reports, as many as 30 people have died by suicide in the last 2 months.
A large majority of them are considered to be as a result of financial problems during the COVID lockdown. Many of them had started their businesses last year and had suffered 2 waves of the pandemic, 2 lockdowns, and they simply could not go on. Many of these people had mounting debts. They had loans to pay. They had children's education to be taken care of. They had even mortgaged their own houses and property as investment for a business that they had started. The light and sound professionals, these are people basically involved in light and sound for outdoor events like political functions, weddings, conferences. So because all outdoor events have been pared down as small functions, light and sound businesses have been very hit. They have had absolutely no business in the last 1.5 years. And about 8 of them, including 5 owners and 3 workers in this sector, have died by suicide, and they have cited financial problems, debt, etc. as the reason for dying. So obviously the rising number of suicides particularly underline the sort of stress in the local economy here, that even the rations and the food kits are not enough, and that people have loans to pay, debts to pay off, and if they are not allowed to open their businesses in a normal fashion, they are facing high mental stress. Perhaps at the local rural level, the government's counseling methods are not working and people are forced to take the extreme step. So yeah, it underlines the stress in the economy and the anger among the people also.
Now going ahead, with the latest Onam surge in mind, Vishnu says that the government is taking the situation quite seriously. The health ministry has said that the testing will be expanded, especially in districts where the vaccination coverage is slow.
So if you look at the state's pandemic plan also, there are districts like Kozhikode, Malappuram, Ernakulam, Kollam, Palakkad, Thrissur. These are the districts which are reporting a high number of cases. But it is quite uniformly spread out. It's not that any district is not affected by the virus at all. It's not that. And the vaccination figures are also vary from district to district. For example, a district like Ernakulam has done very well in vaccination. And so the health minister said that in areas with low vaccination coverage, high testing will be done. The model to be followed is that more people, especially health workers or the frontline workers, those employed in grocery shops, hospitals, pharmacy stores, etc., they will be subjected more to testing because they are in frequent contact with the public. So testing will be ramped up. But as of now, the government is following the WIPR model of containment, which is the one currently being followed, which is the weekly infection positivity rate, where the infections are calculated based on the population of the local body, and they can impose restrictions based on the WIPR count. So if the WIPR count is more than 8, then there will be restrictions. If it's less than 8, then relaxations will be given. That's the sort of policy going forward. The state also plans to give the entire adult population with at least 1 dose of vaccine by the end of September. And the state seems to be doing very well in vaccination. In fact, half of the state's population have been vaccinated with at least 1 single dose. And the government thinks that it can vaccinate the entire adult population with at least 1 dose by the end of September.
You were listening to Three Things by the Indian Express. Today's show was written and produced by me, Shashank Bhargav, and was edited and mixed by Suresh Pawar. If you like the show, then do subscribe to us wherever you get your podcasts. You can also recommend the show to someone you think will like it, share it with a friend or someone in your family. It's the best way for people to get to know about us. You can tweet us at Express Podcasts and write to us at podcasts@indianexpress.com.